I've actually had numerous patients like this. I actually just had one like 2 weeks ago. Someone relatively young presenting with chest pain. Have you guys just introduced you to Eric? Some things that kind of pop up, and maybe like the triage nurse just kind of left as a side because of the age. This is someone that does have a chest pain that's coming in with a radiation to the left arm, but he's a smoker. There's a family history, a strong family history. His dad had a heart attack at 38, and he knows that information. He tells you that information upon asking, but really nothing else that's there. Vitals from triage, not very impressive. EKG, you get the nonspecific ST segment. What is it? You get told BER, like nobody's actually handing you these things until you actually analyze this. But chief complaint concerning. So 3 catches here as well. Risk stratification. We use validated things like heart scores, placing this patient into a moderate risk. You go through things in your mind as well about like, hey, should I get serial troponins? Like, what am I doing? Am I doing my standard, workup for someone presenting with chest pain? And then also giving a can't miss diagnosis, kind of thinking about these things. But Sayvant is able to step in, of course, with the help of BMJ to say, hey, we're flagging this as a potential. Looking at the level of evidence of things about pulmonary embolism, things that will also like service to the top. So I'm going to show here just with that high risk diagnosis and exactly how this looks in that interface. ACS pops up, pulmonary embolism pops up. And it all services with the recommended workup as well. So that's what evidence-driven recommendations and support actually looks like in real practice and what's happening now.
Yeah. And so why this is also very important is that we're not actually, changing anything about what the doctor is doing. But what we're doing is prompting them to say, hey, you may have forgotten about this. You may not have the most latest information about things you may have read a while back, but here's something relevant that you may want to look at. And you can also reference back to the source. And BMJ follows various guidelines in the US and globally as well. We have US standards and also international standards that we follow. And we curate all this information so it's easily consumable for clinicians like Andrew without having to read documents and documents of information. We're actually bringing the most relevant information up to the forefront so that's at the point of care and is directly impacting their service and also their state of mind, because he's a very busy man in the emergency room. He won't have enough time to do all the searches. And just to summarize, some of the things here you'll see that Andrew kind of mentioned is, the drug information, right? You want to know what kind of relevant drug you may be using or should be considering. You may be not familiar with latest information, right? It's not your fault as a clinician. You just haven't had the time, right? We also reduce cognitive load and also charting time. But one thing that Sayvant brings out is not just the transcribing and the interaction. It's actually the documentation, and also think about reporting, right? You can actually do MIPS reporting down the road and coding and things like that as well. That's what they also provide. So all that really helps the clinician in terms of delivering and more focus in their patient engagements, but also having the confidence with the content of BMJ behind it to support what they're doing.
Yeah, that's exactly right. And, we're not here to supplant or replace that clinician judgment. We're here to augment that. People talk about like what exactly is AI doing and how is this actually, benefiting patients, clinicians, and this is where we're at. We're not here to supplant. We're not here to replace that, just here to augment. And that's exactly what we're doing, and also capture the things that you're doing. People talk about too about like, hey, like, is there going to be this upcoding issue? There's going to be these things in the chart that maybe not have occurred. That's not what's happening here. It's capturing everything that you're doing without that extra step and extra mile from start to finish of that patient encounter.